Okay, well, welcome everyone. This is our February HBCU Learning Collaborative. I want to thank everyone for taking the time to join us today. Before we get too much further into the presentation, I want to mention that we are recording today's webinar. So if you miss a section or you would like to pass it on to a colleague, you can find the recording by going to www.campaignforaction.org/webinars. Today's presentation is also very beneficial for your students to view, so we also encourage you to share this recording once it's posted. I now have the honor of introducing today's speakers from the Food and Drug Administration. To save on time, I will not read their full bio, but I will make it available on the website along with today's recording. Our first guest speaker is Captain Latanya M. Ford, and she is the Safety Regulatory Project Manager at FDA, and that office is of Surveillance and Epidemiology. Additionally, Ms. Ford fulfills the roles of the Second Vice President and Membership Chair for the Black Nurses of Southern Maryland, a chapter of the National Black Nurses Association. Joining her is Lieutenant Commander Gladys Williams. She is an active duty pharmacist with the United States Public Health Service. She currently also works at the FDA's Office of Surveillance and Epidemiology as a project manager and a contracting officer representative with the regulatory science staff. Lieutenant Commander Gladys currently serves as the work group team lead for the DEIA HBCU initiative, which we will discuss today. So I don't want to take up too much time. I'm going to go ahead and hand it over to our guest speakers, and I'll let them take it away. Thank you.
Thank you, ma'am. Good afternoon, everyone. Thank you for joining. I will start our presentation shortly. And for the purpose of our presentation, we will be going off camera when we start speaking. Thank you for joining again. All right, good afternoon, everyone. My name is Lieutenant Commander Gladys Williams, as introduced by Ms. Cooper from the Food and Drugs Administration Center for Drug Evaluation and Research, Office of Surveillance and Epidemiology, and I am the work group lead for the HBCU initiative. So why are we presenting to you today, being HBCU initiative and also being February Black History Month? So FDA has taken this initiative seriously as the 2022 White House initiative came out as the President Biden's initiative to extend opportunities to students from underrepresented opportunities. The White House initiative is also a part of FDA's 2022 to 2025 strategic plan. And this is our objective 5, which is enhancing outreach and recruitment and retention efforts to increase representation of underrepresented group. So we have taken this initiative seriously in our office to reach out to HBE students to talk to them about initiatives and opportunities that reside within FDA and the Center for Drug and Evaluation and Research. So today we'll be talking to you about all the things that we see on the slides, the agenda, the HBCU initiatives, which I have already spoken about, OSC opportunities, and also opportunities for nurses within the public health service. This is an org chart for our office, the Office of Surveillance and Epidemiology, as FDA is a huge organization. So the OSC falls under the Center for Drug Evaluations and Research, which is one of 4 centers within FDA. And the Office of Surveillance and Epidemiology consists of 8 divisions within OSC and the immediate office. So these are all the 8 divisions and the immediate office that is represented on this slide. Now, what do we do in these 8 divisions? I'm going to go over briefly what each division does. So we have the division of pharmacovigilance, which monitors drug safety signals and other activities relating to detection, assessment, and prevention of adverse events. We also have the division of epidemiology, which is divided into 1 and 2. We call them DP1 and DP2 for short. The core function of the epidemiology division is gathering safety and real-world efficacy data. And this is an essential part of what FDA does because it's a part of the new drug and biological application review team. The epidemiology division, also known as the DP2, which is the second branch of the epidemiology division, provide drug use data that supports the overall epidemiology review of the FDA. The next division is the division for medication, error prevention, and analysis, which is also divided into 1 and 2. And this division serves as the scientific lead for medication errors. And they ensure drugs are safely used by minimizing errors in the design, administration, labeling, packaging, and naming of drug products. So we all see commercials that come on TV with new drugs almost every day, and we do want to minimize risks. That is why all these divisions are in place for us to minimize risks, because we want the medication to be safe, effective as they go into our bodies. The next division is the division of risk management, and they serve as the focal point for risk management activities within CEDAR. And they work to develop and implement programs and initiatives to support the center's policies related to risk evaluation and mitigation strategies, also known as REMS. So the risk management division review all REMS proposal and conduct post-marketing modification to approved REMS. And REMS was established under the Food and Drug Amendment Act of 2007, which gives the FDA authority to put certain drug products. So certain drug product falls under the REMS, the mitigation and evaluation strategies. And these drugs follow certain protocols before they are approved onto the market. So the risk management division takes care of these medications as well. Next slide. Here is all the workforce disciplines that you will find within OSCE. So as you can see, it's very diverse, from pharmacists, myself, which I currently don't even wear the hat of a pharmacist, but that's how diverse we get within FDA. So from pharmacists all the way to acquisition specialists who, which manage contracts, which I currently wear that hat. Next, I will pause and show a brief video about what FDA and CEDAR does. And after that, Captain Latonya Ford will talk to us about nursing careers within FDA.
You may know the FDA is responsible for approving new drugs and making sure those drugs are safe, high quality, and work the way they're supposed to. But how is it done? How are decisions made? And are those decisions in your best interest? What else does the FDA do and not do? These are important questions, and the FDA understands the importance of asking and answering questions because that's exactly what it does. The highly trained staff in the FDA's Center for Drug Evaluation and Research are committed to protecting the public's health, advancing science, and regulating human drugs. These staff analyze data, evaluate research, and make decisions based on science to ensure that prescription, generic, biosimilars, and over-the-counter drugs work correctly. They use science and data to ask and answer questions like, is this new drug safe? Does it work the way it's supposed to? Do the benefits of this drug outweigh the risks? And once drugs are approved, The FDA monitors them for safety and quality for years to come. This thorough analysis helps the FDA provide the timely information healthcare providers and patients need to choose treatments wisely. The FDA's decisions are not influenced by industry or politics. The FDA's decisions are guided by science and data. It's important to know that the FDA oversees clinical trials for safety and reviews the resulting data. However, the FDA does not conduct clinical trials. FDA also does not control the cost of drugs and generally does not have a role in interactions between patients and their healthcare providers. As part of its public health mission, the scientists and staff at FDA work to protect the American public by getting the accurate, science-based information they need to use medications wisely, all by asking questions and letting science lead to the answers. Questions about FDA and human drugs? Find the answers at fda.gov/drugs.
Good afternoon, everyone. While Lieutenant Commander Williams pulled up the slides, I'm going to take this time to tell you a little bit about the person who's going to present before you. My name is LaTanya Ford, and I cannot believe I've been a nurse for almost 30 years this year come June. And I've been an employee at FDA for 14 years and 9 months. You will hear that again, 14 years and 9 months. I have a lot of experience in clinical, and my favorite is the emergency room. So when I come to you today to present, I am presenting to you with some enthusiasm, excitement, because I did not know all of this existed when I was in nursing school. So on each slide, I want you to have a takeaway from it. As you already heard, we talked about CEDAR. That's where we work currently. If you could take a few seconds and put in the chat your name and where you work, and if you're a student, because this presentation, as you heard, is geared towards students. And if you're a faculty or anybody in your family who's a nurse, pharmacist, or may have some interest in FDA, please take notes for them. I'll get started now. As you see, FDA nursing opportunities. As you saw a little bit about CEDAR, okay, CEDAR, and that's the division we work for. That's the drug center. CBER, the Center for Biologic Evaluation and Research, that's the Biologic Center. So they like to ensure the safety and efficacy and the quality of biologic products are safe. Now, CDRH, which is, I like to say, our device center. They collaborate for the medical devices and radiation imaging products. So all of the regulation for medical devices, they are to ensure that they're safe, effective, and they are of quality. CISPAN, I like to say that is the food and cosmetic division. They regulate the safety, labeling, proper use of food, dietary supplements, and cosmetics that we use in the United States. CTP, Center for Tobacco and Products. They regulate tobacco products to reduce their harmful impact on the individuals and community. Now, I didn't say to eliminate, that's to reduce the harmful impact on individuals and communities. CVM, Center for Veterinary Medicine. Yes, we have veterinarians who work for us, and we have animals that are part of FDA. They regulate the safety and effectiveness of veterinarian products to ensure the safety of all animal-derived food products. Now, NCTR, the National Center for Toxicology Research, they conduct scientific research to support FDA regulatory decisions on safety and efficacy of various products. So that's not just drugs, that's not just food, it's various products. And this is the only, I want to say, office. If you look down there, we have the 4 offices that does not have an acronym. We have a lot of acronyms at FDA. The Division of Document Management, they manage and regulate our documents associated with FDA regulations, the policy, the guidance documents, public hearings, meetings, and public comments. ORA, which is the Office of Regulatory Affairs, they enforce the law. So they ensure compliance with federal laws and regulations are related to all FDA products are enforced. So they do our inspections, investigation, and compliance enforcement. Last but not least, the Office of Commissioner. They oversee the FDA overall mission, strategic direction, and policy priorities. Next slide, please. Displayed above are various job titles held by nurses within FDA. Nurses play an important role, and we undertake jobs for clinical review, regulatory affairs, adverse event reporting, safety of patients, education for patients, drug information communication. We are also involved in the oversight of clinical trials. My first job at FDA was a patient labor reviewer. I did not want to leave the ER, but when I found out about this job, I said, oh, I'll get to do some of the same things that I did in the ER. Well, with this job as a patient labor reviewer, I was able to write or compose and assess patient information and medication guides for the consumer. So that's that discharge paper that you give to somebody when they're discharged from the ER. And the drug products, not the professional information, but in layman's terms, we wrote on a 6th grade level for patients. So I really loved my first job at FDA. It bridged that connection to the ER for me. Then I went to a consumer safety officer position. In this division, I found out about the law, okay? This is a division for disclosure and policy. I found out all about the Freedom of Information Act, FOI. So we redacted the proprietary information from the entire approval package. I had the opportunity to see what everybody was doing under CDER when they was doing reviews and everything else, when they went to the lab, and I was able to redact all that information. And finally, I went over to the Office of Surveillance and Epidemiology, is what's the division that we work in, that Commander Williams spoke about. And that's where I became a safety regulatory project manager. My primary role right now, I oversee the safety aspect of projects. And I work with oncology products. I didn't think I was going to like this because I was a cardiac person all the way. Give me a person who was having chest pain and I could take care of it. But once I got there and I started to find out all about oncology and the drugs and how the market worked, I was very interested. And things are ever changing, just like in many other jobs. Next slide. So I took it upon myself to do a poll, well, along with another nurse at FDA. We send out a poll to over the 200 nurses at FDA. We tried to reach civilians and public health service officers. And out of that, we got at least 50 people to respond. And as you can see, the top centers of the divisions for where nurses work were CDER, that's my division where drugs are, ORA, the enforcement division, and something that we haven't talked about already, Office of Minority Health and Health Equity. So ORA, as you know, we enforce the law there. A lot of officers, I keep saying officers, you'll get to hear about this later. A lot of employees go out and they inspect, investigate, and they really enforce the law. They're able to travel all over the world, not just in the United States. So the Office of Minority Health, they're responsible for addressing health disparities and promoting health equity among minority populations. So when you see things in the news about minorities and maybe it's not this, that, and enough for opportunities with drugs, you better believe that the Office of Minority Health, they may have a hand in that with trying to get communication out and gather information. Next slide. Jobs. Now you say, where do I sign up? How do I get involved in FDA? How can I take advantage of what jobs are there for me? It's more than just nurses and pharmacists that work there, although there are a whole lot of pharmacists there. As you can see, we have divisions for scientists. So the scientists research and analysis. And then we also have regulatory affairs where we have lawyers work there, regulatory sciences, reviewers, compliance officers. Then if you want to look at the screen, you can write down this website. So you can go to www.fda.gov about-FDA, or you can go to usa.gov and find out about more of the job opportunities at FDA. Next slide. I'm not here to convince you, but this is all true on this slide here. There are a lot of growth potential. One is they have training programs. You may have heard of pathway programs. We have a commissioner fellowship. They offer continuing education, regulatory science training, industry training, and outreach. We also have career development. The FDA supports career development and advancement through mentoring programs, leadership training, professional development opportunities, and networking events. There's one networking event that I participated in for about 5 years, and you may have heard of it. It was called Toastmasters. Very good organization. Then I also went to Georgetown University through FDA and received a certificate in public health. And then I went to Duke University and received a project management certificate. But we also do a lot of meaningful work. Employees at FDA have the opportunity to contribute to the mission, that mission of protecting and promoting public health. And you'll hear that mission again later on. Our professional development is great, as you can see. They have a comprehensive benefit package. FDA employees have a comprehensive benefit package. They help families to maintain their health and financial security. And it's so much more. Next slide. Here we have life balance. I don't know what I could say. I know COVID has changed a lot for people and made people evaluate their work-life balance. FDA values the work-life balance and offers a flexible work arrangement. That includes telework options, alternate work schedules when feasible, and it allows employees to balance their professional responsibilities with their personal commitments. I do know a couple of people, as a result of COVID, they were able to move around and still work at FDA in different geographical areas. Next slide. Now, this is the fun part. I wear 2 hats. I'm a nurse, and I'm also in the United States Public Health Service Commission Corps. I actually commissioned 14 years and 9 months ago. There that number is, right? The first day I showed up at FDA was 14 years and 9 months. It was on April the 15th. Now, the next segment is really dear to my heart. I am a proud officer, and I am glad I signed up for the Commission Corps. Next slide. So you say, what is the United States Public Health Service Commission Corps? We are one of the uniformed services inspired to serve vulnerable and underserved communities through addressing public health issues. You may have seen us in a blue uniform as Commander Williams and I have on today. You may have seen us in uniforms that look like the Navy during COVID. We went out for missions like that, and I'll talk a little bit more about that later. Next slide. So we come under the Surgeon General. The Surgeon General is one of the primary leaders of the United States Public Health Service Commission Corps. As the nation doctor, the Surgeon General mission is to restore the trust by relying on best scientific information available, by providing clear, consistent guidance and resources for the public, ensuring that we reach our most vulnerable communities. As a Vice Admiral of the United States Public Health Service, Dr. Murphy commands a uniformed service of 6,000 people, 6,000 public health service officers. Let me rephrase that. Dedicated public health service officers who serve underserved and vulnerable populations domestically and abroad. Yes, we are out of the United States as well. The Surgeon General is responsible for assuring that our day-to-day management of the United States Public Health Service Commission Corps run well. The Surgeon General also have the public health impacts at his best interest. We aim to help everyone understand that these issues and how they work together to take action, such as COVID-19, keeping our families and communities safe from the COVID pandemic. The health misinformation, you may have heard a lot about this. With the abundance of health information available today, it can be hard to tell what is true and what is not. Many are exposed to health misinformation, information that is false, inaccurate, misleading, according to best scientific-based evidence. And then healthcare worker burnout. You may have that, you're not even a healthcare worker. The pandemic has brought out our nation's healthcare workers and to a breaking point, brought everyone to a breaking point. They're experiencing never before seen rates of burnout. So as a result, we're seeing psychological distress, workforce shortages, and we must act to support our healthcare workers with all that they need for healing and to thrive. And that's for everyone, right? Youth mental health, as far as many people can remember or many people know, our youth, they're very important to us. They're our future. And they're struggling right now with mental health and the ability or inability to obtain support. Maintaining healthy children and families requires a society, including policy, institutional, including changes in how we view and prioritize our mental health. And if you want more information about the Surgeon General and some of his initiatives, please visit the site that's posted, or you can just Google it. It's everywhere. At this time, I will turn the presentation back over to Commander Williams to conclude. Yes, she's a pharmacist. I'm not going to hold that against her. I will go ahead. She's actually one of my closest pharmacist friends. I'm serve as a mentor to her, and I am very proud of her. And I will make her an honorary nurse one day. But at this time, I'd like to turn the presentation over to her. If you have any questions, please put them in the chat and we will answer all questions at the end. Lieutenant Commander Williams, are you there?
Yes, I am here, ma'am.
All right. You may
I
continue.
think I'll accept that honorary degree. When I worked at a hospital, the nurses were my best friends and we fought all the time. All right, thank you, ma'am. So continuing our conversation about the public health service. So what professions can go into public health service? So these are all the professional categories that serve under the United States Public Health Service, from medical officers all the way to scientists. And we do get a lot of questions, even from our sister services, because we are really, and I think this is true, one of the best kept secrets. Because even when we are on basis, our sister service asks, who we are, because they're not as familiar with us. But we do also wear the uniform and we wear it proudly, as Captain said. Next slide. So this is one of our nurses on a deployment mission, showcasing her effort as an officer. There is approximately 1,300 nurses in the Commission Corps, and they served in various capacities, from public health nurses to pediatric nurses. Okay, and we also do go on deployment. So what are some of deployment roles? Nurses serve in these capacities when they go on deployment, and I will let Captain Ford talk about this when and briefly about her deployment opportunities.
Thank you. So I mentioned earlier during COVID, we were able to go out, and I did a mission in Minnesota. So in Minnesota, we had a team of about 30 individuals, 20 of them about nurses, and we were tasked to go to 5 different nursing homes and help with staffing. There, they had problems with staff shortage because everyone had COVID, and they were worried about their residents dying. And yes, we encountered residents dying. We had to worry about our safety first and how to strategically plan and work to help them in all realms of healthcare. And when I talk about all realms of healthcare, you're talking about staffing, you're talking about supplies, safety, as I said, food, logistics. And it was a successful mission. We had nurses with various, I want to say, specialties. I had a nurse from CDC. I had a nurse who worked with Dr. Fauci. I had a nurse who was in education. So various nurses with different degrees of nursing, and people volunteer. And that's what we do. We go out, and it was snow. And I remember I was the team lead, I was the team lead, of course. And we worked with the Department of Health. And that was a humbling experience, because not only were they working with us as we were trying to help, they were working with hundreds and thousands of people in their areas. And so it was very successful, and that's what we do. And we stayed out for more than 30 days. And just think some people had kids and families at home. And in that deployment, I learned so much. I mean, it's you learn life lessons as you're using your skills, and you say, this is what I'm made for. And in that deployment, my right-hand person got COVID. And I'm thinking about, well, how does that happen? I was looking at Captain Ford as being over the top, wearing my mask, glove, double mask. But we didn't know what we were going into. And this is what officers do. You don't know what you're going into, but you use your scientific-based information that you have, you use your experience. And there are so many other deployments that I can talk about, such as with the hurricanes. And yes, sometimes you go kicking and screaming, but when you go, you say, this is what I was made for. This is what I was trained for. This is the experience. And quite frankly, I'm not put somewhere that I don't think I belong. So thank you for the opportunity to share deployment experience, and you may continue now.
Thank you, ma'am. Okay, so this says nurse officer required qualification, but it really applies to everybody that is interested in joining the United States Public Health Service. You have to be a citizen. You have to be less than 44 years of age. There may be age waivers sometimes that some officers may qualify for. And there is also a mandatory 8-year commission service obligation, which means you have to do 8 years before you can separate from the Corps if you do decide to separate. And you have to have an unrestricted valid license in the United States and its territories. And the minimal degree is a bachelor's degree, BSN Science and Nursing. Okay, so at the FDA, this is a continuation of Captain Ford's survey that they did. And when she talked at the beginning of her presentation to find out how many nurses work at the FDA. So overall, they were able to reach 51 nurses, and 41 of them were PHS nurses, and 10 of them were civilian nurses. Ma'am, do you have anything additional to add to the survey?
No, ma'am, but we do have about 200 nurses at FDA. Is it difficult to reach all 200 nurses because they are all over the centers and offices, but we are striving to get more information and gather more data to be able to provide for more presentations like this. Thank you.
Thank you, ma'am. Okay. So initially we spoke about which professions are in the public health service, which were several professions. Now, this is where we work. So the United States Public Health Service currently has a presence of more than 800 locations, which includes all 50 states and numerous foreign assignments, such as World Health Organizations and World Bank. So this is how diverse our officers are in diverse locations all over the world. Officers work at the U.S. Department of Health and Human Services, which is our primary agency. So I like to explain to people when I'm asked about our service as the sister services, except Coast Guard. Coast Guard is under Homeland Security, but the other armed forces are under Department of Defense, as we all know. But Public Health Service is primarily under Health and Human Services. But we do also help with work with DOD and Homeland Security, USAID, and Department of Justice, as you can see on the slide. So these are all the different places that you will find a PHS officer working. Okay, what are the benefits of becoming a PHS officer? It's very rewarding, and it's one of the most beneficial things you can do as a healthcare provider. It allows you to be very diverse in your career. As we've both shared, Captain shared, she was a nurse in the emergency room, but being a PHS nurse has allowed her all these diverse opportunities and things she has learned on deployments in her career, which she may not have had if she, went on the traditional nursing path. Same here. I am 10 years in. I'll be 11 in August. So with my 11 years in, I've served under 3 agencies, which the first one was Indian Health Service. I served on the Navajo Nation Reservation as a clinical pharmacist. So over there, I worked as a pharmacist in the hospital, also outpatient pharmacy, and we had clinics. This is where I bonded with my nurses. Hence, we have a very good relationship, Captain Ford and I. So that was my first assignment. And then my second assignment was with Department of Homeland Security as a program manager. And I got asked this question all the time. What is a pharmacist doing at Homeland Security? But again, you can map out your career to be as diverse as you want. So that is where I began my project management experience and skills at, and also started working with federal contracting. So from Homeland Security, then I came to FDA, which is my third assignment. So that is all the diverse things that she can do as an officer within Commission Corps. We also have a lot of professional development where there is many opportunities for training and education to advance your career. We do have 30 days paid leave, which you can accumulate, and it starts accumulating on the 1st of each month as an active duty officer. And the last bullet, which is financial advantages, you do have, I don't want to go through all of them, but there is housing allowance, like our sister services, retention bonus, paid retirement, and things like being able to get a VA loan if you want to be a homeowner. Okay, so for the students or faculty, if any of the students or anyone you come across within the professions that we shared is interested in joining the Corps, they may ask, well, how do we get started? We do not have, recruitment offices like our sister services, but you can visit our website on usphs.gov, start your application. You have to meet your medical standards, check all the application checklist, and someone will be in contact with you. Yeah, so these are all the 8 steps on becoming a PHS officer, if you do decide to become a PHS officer. Okay, so that concludes our presentation for today about FDA OSC, where the HBCU initiative, where we're reaching out to minority students, and the public health service. Thank you all, and we are ready for your questions.
Great, thank you so much. Is there any questions that anyone would like to ask about the program or how best to get it connected to your students?
I do have a question. Just how can we connect to our students? So I think I might be the only one on here that's from the Pennsylvania and the Action Coalition, and we have a mentorship program. So I'm just curious. I know this is focused on HBCU. We have a few HBCU students in our program, but just curious, for other opportunities.
Would you like to take that, Gladys?
Yes, sure. We are open for mentorship opportunities for students in HBCU and even other underrepresented communities. So you can share our email address with the students who would like to get in contact with us for mentoring.
All right, thank you.
Thank you.
I don't really have a question. I just wanted to say thank you so much for presenting this information. I'm the executive director at Tennessee State University School of Nursing, and I think this is such a wonderful opportunity for our students to hear about all this. So I will definitely be sharing, this video recording with them as they just consider all of their options. I mean, I had no idea, about all of these different things that are available. So thank you all so much for, shedding light on this. And I just think it's wonderful. So thank you.
You're more than welcome.
Thank you.
So as you all share the information, please don't forget to share the website. It's very clear. You can actually email people, especially for the United States Public Health Service. You are able to email and get questions answered. We will provide our email address. At the matter of fact, I'll put mine in the chat right now.
Yes, I'll do the same.
Oops.
All right, any other questions or comments before we get ready to close out? And I'll make sure that their contact information is listed on the website. Of course, everyone will get an email notification once everything has been uploaded. So that way you're able to share the link with your students. And I do see another question has come through. Yep. You can go ahead.
Yes, thank you. I just wanted to thank the officers as well for sharing that information. I am the national president for Chi Eta Phi, which is a professional nursing organization, and we have undergraduate students that are members as well. So our third vice president, who is usually an undergraduate, she will be able to share this information, and hopefully the recording of this session will be available so that she can share it with our undergraduate students, and they will learn of these opportunities available as well. And thank you again.
You're welcome.
You're welcome, ma'am.
I am very familiar with Chi Eta Phi.
Great. Well, thank you both Latanya and Gladys for joining us today. Will actually be featuring them in 2 other learning collaboratives that we have with our different audience groups. So we're excited to bring them back in April, but we definitely wanted to make sure that our HBCU groups were aware of the program, and we'll continue to engage the FDA with any other opportunities that come up. But we just appreciate your time, and we are grateful for you to share this program with us, and happy to pass the information along.
You're welcome. And thank you, Jasmine, for making this.
Thank you, ma'am. Thank you, everyone.
Yes, thank you. Have a great day, everyone.